So a lot of decisions as it relates to Medicare, a lot of information out there. One thing you can rely on, and I think Mike will back me up on this, is that the rules change. They're not static.
Yeah, they changed this year, too.
They're very dynamic, and they change this year. So joining us is Mike Knight, Benefits Advisor for People's Health. Mike, thank you for joining us, and thank you for hosting us again today out here. Always love visiting with you guys at People's Health. Y'all have got it together for sure, and we appreciate it.
Yeah, thank you for coming out. Great to see you again.
So the annual enrollment period has been going on for a period of time now. It ends December 7th. You have to get these decisions in and made, and there is a grace period I think you had talked about before, but we'll talk a little bit about that. But the 7th is the day, right?
For most people, it's going to be December 7th, which is this coming Saturday. The grace period, I don't want people to think, oh, I've got plenty of time. If you're on Medicare now and all you have is Medicare, you don't have any other special election periods, you got until Saturday to make any decisions.
Absolutely. So we're here at the People's Health Medicare Center. You guys have stood this up for a while now, specifically to have open access, readily available. People ask me about it. I said, look, the best place to go is right there at 3017 Vets. Walk in. Those are the experts. They're going to steer you where you got to go, what you got to do. And almost everybody that I've sent over here said, man, what an experience. I'm so glad I talked to you and you got me in there because now I understand.
Yeah, thank you for doing that, too. I mean, as a matter of fact, somebody came in just the other day and said that they came in just because of you. They're welcome to come in. And we're going to give them information. This is a great place to come. It's unbiased. I mean, obviously, we're representing people's health, and we'd love to talk to them about that. But if it's not the right situation, we're going to tell them maybe a Medicare plan isn't right for you.
Yeah, and I've had people come back and said they suggested something different.
Mm-hmm. Right.
And they were shocked, quite frankly, but they were happy because they felt like you guys were straight up with them, and it was they got the information that they needed. And there was something a little odd about something that they needed that made sense for them to go in a different direction.
Right, yeah, we're going to look at them as an individual. It's not just a cookie cutter. We want to ask what they're doing, what's going on. Do they have dependents? If they have a wife that they have that's still on a work plan, and if not, I mean, we got great products, but they're not exactly for everybody.
Right, absolutely. So let's talk about the annual enrollment period. What does it mean, and what's it totally all about?
So annual enrollment, this is the one time a year where Medicare lets you make pretty much any kind of change you want with your Medicare. You can add drug coverage, you can get rid of it, you can swap plans, you can look at new plans, and this is kind of the heyday, if you will, of the year, where you can really just look at anything and say, I want that, and then it will become effective for you.
So that started on the 15th of October. It goes through December 7th. We're sitting here on December 5th. Right, and so you still have some time to do that, and these are things that people can come here and do. Right,
we are here. So if they want to come by, we're here every day till 5. They're more than welcome to come in, sit down. We have 2 seminars tomorrow, so if they want to come by, we're more than happy to discuss with them and see what their options are.
So if you're with Medicare, is this the only time that you can make these changes that we're discussing?
This is the main time. You will have, so beginning in January 1st through March 31st, you have an open enrollment period where you can make some changes. And then you have other people, like if they have special elections, if someone has Medicare and Medicaid, or if they have a chronic health condition. People's Health will have some new chronic special needs plans for next year. If, let's say, they develop diabetes mid-year, that plan becomes an option for them. Or if they move in or out of the service area, will be another one.
So those are all the exceptions to the general rule about the enrollment period.
Correct.
Right. And then if you have a change in your situation, in your life or your status, let's say you're working, you're over 65, you have an employer-sponsored plan, and you separate from that employer.
That's the time, too. So, the other two big ones, I'm sorry, I didn't mean, but definitely, if they're leaving a group insurance, they can join any time of year. If they're aging in throughout the year, they can. If they're turning 65, they can join at that time as well.
So, and I'm glad we're covering this because I think a lot of folks get confused by this window that everyone talks about. That's kind of the only time.
Right. Yeah. And this is the time. If you're already on Medicare, then now is really your time. But if you're still working, if you're turning 65 in March or any time next year, even December, if you turn 65. You're not bound to that December 7th deadline.
Right. So folks that have been on, they've probably received some kind of notice already about changes, right?
Yeah, they should have received it prior to the 1st of October. It should have come in the mail.
Unfortunately, I think a lot of that stuff gets thrown out in the junk mail.
Does not get read, right.
But this year, it's even more important to read it because there are changes this year, right?
Yeah, the biggest changes this year, Medicare did away with the coverage gap or the donut hole. Most people know one of those two terms. And so what they did is they closed that gap for 2025, but they did go to a deductible plan. So under the traditional Medicare plan, they have a $590 deductible before their health plan will pay for medications. Each plan, it's up to them how they design that plan, but that's kind of the framework of it. And then they have a $2,000 out-of-pocket maximum.
And that's regular Medicare.
Regular Medicare,
right.
Correct.
Because there's all kinds of other options. So what's the best way to go about trying to figure out how these changes are going to impact you as an insured?
So the best thing to do, they should have read that paperwork that came in October. If they didn't and they want to come by here, we can talk to them about it. They can call Medicare. They can call the Council on Aging, even SHIP for Louisiana. We'll be able to help you determine it, but they really want to get on the ball and do it.
Yeah, you got to get that done. So if you want to change your coverage, what are the options that you have, and how do you go about doing that?
So this time of the year, they can change from any type of plan. So if they don't have Medicare drug plan, they can change. If they do have a plan, they can change to something else, or they can drop coverage. That's the biggest options right now. They can go to a chronic special needs plan, which we're offering a couple of next year. They can also just stay with what they have. They don't necessarily have to make any changes.
So let's go a step down the road. The difference between original or regular Medicare, most people call it like regular Medicare, and Medicare Advantage plans.
Okay. So the original Medicare is run by the federal government, and they have established guidelines for that, and that's what you get when you first turn 65. The
right.
Medicare Advantage plans, you have to actually elect to be part of. Generally, they don't cost any more. Generally, they're going to offer much better benefits than traditional Medicare. But you have to do your homework. You want to check doctors, medications, just to make sure it's going to fit what you're looking to do.
So there is a difference then between the panel of physicians available under original or regular Medicare and those that are available under Medicare Advantage plans.
They can differ, yeah.
They can
not
differ.
Always, but they can.
And the same would hold true with the formulary for prescriptions?
Right. So what Medicare does is they come up with recommended medications. Medicare plans, like People's Health or standalone drug plans, they have to cover at least one medication in each category defined by Medicare. So it could be a different medicine for each company. So that's usually the two biggest things. They're going to be doctors and medications.
And they're two important things, right? I mean,
yeah, those are the two big ones.
You know, because if for example, you can tolerate if there's a drug on the formulary of one plan that you've already tried but you didn't tolerate it very well, you got a lot of the side effects. Mm-hmm. You've moved to another one, which you are tolerating well. You want to be able to understand which one is offered by which plan.
Right. How the coverage is, because it might be on a different tier with a different company. Or they may require some kind of an authorization before they cover it, a letter from your doctor. Mm-hmm. So, yeah, those are real important things.
So the Advantage plans do have some latitude and willingness to modify in special cases.
On a case-by-case basis. And
right.
A lot of times it would require a letter from the doctor, and then they would be reviewing.
So let's talk about, you said that you're going to get a more robust benefit package typically with Advantage plans than you would with original or regular Medicare.
Correct. So your Medicare Advantage plans are going to offer things that a lot of people look for nowadays: vision, dental. The People's Health plans cover fitness center benefits. We have over-the-counter cards where you can go get your cold remedies, your vitamins, first aid products, and even some of our Medicare, Medicaid, our special needs plans cover food benefits.
Really? And let's talk about pricing. is Medicare Advantage more or less than original Medicare?
There's no cost for any of the plans that we offer. So there's zero premium plans. You continue to pay, if you're paying your Medicare Part B premium, if there's no assistance from the state, you continue to pay that, but there's no extra cost. And then some of our plans do have a give back where we help reduce the amount that they're charging you for your Medicare Part B.
So what happens with Part D?
For Medicare Advantage plans?
Yeah.
So Part D is included in most of our plans, and because we want our members to have access to affordable medication.
So it could hold true that there's no cost for that either?
Correct. Right, yeah. We're going to absorb the cost of that because we want you to be able to be well-rounded. You know, you have access to doctors, but if you can't afford the medicine, then you're halfway, but you're not quite getting all the coverage that you need.
So these extra benefits, they don't increase the cost at all because, as you said, the people's health plans, there is no cost.
Right, yeah. We don't have a premium. We're 100% funded by Medicare.
Right. So a lot of folks shy away from making those selections, I guess, or choosing because they fear they're going to get charged at some point in time.
Yeah, they think there might be premiums. They get a little bit overwhelmed with looking at things and trying to understand how it works, and that's one of the reasons this place exists, because we want to kind of clear that air and just make sure that you can make decisions on what's most important to you.
We've been out to the Y with you guys, and visited out there, and a good percentage of the membership out there, they're members there as a result of y'all.
Yeah, we're happy to sponsor that because our members that exercise are in better health, so we like to promote that idea. Just stay healthy, and that way you don't need to go to the doctor as much.
It was amazing because the first time that we've been out there twice with you guys, the first time I was out there, people were literally bragging about having this benefit and taking advantage of it. You could see how happy they were. They had never worked out in their life.
Yeah.
They'd never exercised in their life, and they were out there as a result of this benefit in the plan.
It offers a couple of things. It gives you a social aspect. It gives you the physical aspect.
Mm-hmm.
It helps cognitively. It's just all around, and there's nothing like being around happy people.
Yeah, and I will say that's a happy place out there.
It really is.
They have a good time. There's a number of different Medicare Advantage plans, right? Are they all similar in nature or similar in cost?
So the structure of them is going to be similar. Each plan is going to design their benefits based on how they see fit to run their plan. So you definitely want to shop around. You definitely want to make sure that the plans that you're looking at are going to cover your needs. Back to what we're talking about, doctors, medications, maybe medical facilities. If you travel, those kind of things, you really want to look at your lifestyle and say, can I find a plan that's going to be able to fit in what I'm looking for?
Yeah. And so you encourage people to go shop around and get the evidence for themselves.
Yeah, and a lot of times we get referrals from people who, our current members, that say, go talk to people at People's Health, go to that service center, because they've come in and they just have a deer in the headlights look where they're like, I've been around to everything and I don't understand it.
Yeah. Are there other costs with Medicare Advantage?
So generally you have co-payments and co-insurances, and that's going to depend on if you go and see a primary or a specialist. It'll depend on the plan that you're covered by. There are some charges if you go to the hospital, but they are much less than what you're paying for traditional Medicare.
And y'all do a breakdown and show all of that as well when folks come in, it is what they would typically see. So when you take this in total, what would the cost comparison look like between a Medicare Advantage plan and original Medicare?
So if you have, under traditional Medicare, depending on if you're going to a doctor, you're going to be paying 20% of the amount Medicare is going to cover. Whereas under health plans like People's Health, you're just going to be paying, most of the times, a defined co-payment for it. So it's not an area where it's going to be 20% of whatever dollar amount that the doctor needs to charge you to perform the services that you're looking for. It's going to be, say, a specialist, either $20 copay, a $10 copay, something clear and easy to understand.
Absolutely. And we talked a lot about, what works for you, but there are other things to consider as well. You know, when you make this choice and choose the coverage that's right for you, that matches your needs.
Right. And so, I mean, as far as the plans that are going to be right for you, similar to what we talked about, you want to check the cost. You want to look at what your benefits are going to cost you. Each plan going to a doctor is going to possibly be a little bit different than the other. The plan's network, is that something that you can work inside of? And then consider coverage. You want to make a list of the healthcare services you get most often. And then ask about extra benefits, the gym membership, the extras that we talked about also.
Yeah, so you want to really kind of self-reflect of your position, your posture as it relates to healthcare needs. And make sure, that's one of the things you want to make sure that whatever plan, that those that you have repeatedly used over the years and the position that you find yourself in are met.
Correct. Yeah, the services that you're really needing or services that you anticipate needing. Have I been to this doctor before? Okay, well, maybe I'm going to see them 3 or 4 times next year, so I want to make sure that doctor's in there. Certain facilities, I've had these tests done. How are those covered? And we can give them all that information.
So you guys are offering a new type of plan this year. You've talked about it, mentioned it a couple of times, chronic condition special needs plans. Tell us about that.
Okay, so chronic special needs plans, they're going to be for people that have certain health conditions. So if you have diabetes or if you have chronic heart conditions, these are plans that Medicare has defined as really needing a little extra care, and they have asked health plans to develop plans to manage those conditions because they can be long-term, they can be difficult to manage on your own.
Are there any other new plans for 2025? I know that's new in 2025. Anything else?
Those are pretty much the ones that we have. I think we have another one that's escaping my memory right now. I apologize about that one.
So before we're running out of time, but before we end, tell us, a lot of folks don't really know what People's Health is, right?
Yeah, we still get that. So we're a Medicare Advantage plan. We're based here in Louisiana, and we're owned by United Healthcare, which is our parent company. But all the action happens here with enrollment and that type of thing. We have member service reps here at the center, and it's just a good local resource where you can come in, get questions answered, talk to a live person, which we've been hearing a lot about. It's nice to sit down across the table from somebody and actually get questions answered.
Yeah, this facility here, y'all thought of everything. I mean,
they did a great
areas
job.
to meet in private. Y'all conduct meetings here. I talk about it on radio all the time. I mean, some are fun, some are serious, and it's all about educating folks, educating them about themselves, the challenges that they face and stuff. And you guys have been great corporate partners. And I hear a lot from people that said, man, I went to that presentation at the People's Health Center. It was great. It's like,
yeah, tell them to come by for a cup of coffee. Then both sit down and talk to them. We're happy to.
Absolutely. Get on by here. We are here today. 3017 Vets, right next to Party City. Can't miss it, right by Veterans and Causeway, the People's Health Medicare Center. We are broadcasting live from here from 10 to 1 today. Come by and say hello. Mike, as always, you have a plethora of information. We truly appreciate you joining us this morning, and have a happy holiday season.
Same to you. Thanks for having me.
All righty. That's Mike Knight, Benefits Advisor for People's Health. We'll be right back. 504-260-1870 on the Oakland Heart Jewelers Talk and Text line. When we return, we'll visit with Bob Ramelli, owner of Ramelli Janitorial. He was one of the respondents to the RFQ for garbage or sanitation services in the French